Welcome to Frederick Memorial Hospital's Regional Cancer Therapy Center. I'm Carol Masterlers, Director of Oncology Services. Almost everyone knows someone, a friend, relative, maybe a neighbor or coworker, who has been diagnosed with cancer. Here at the Cancer Therapy Center, we're here for each of them, providing the treatment, information, and support they need.
FMH is proud to bring the revolutionary CyberKnife system to patients in Frederick County area and beyond. This painless, non-invasive approach can treat tumors previously considered inoperable or inaccessible by conventional surgery or radiation. The center opened in February 2008 and offers new hope for patients with tumors in the brain, spine, lung, abdomen, and prostate. Hi, my name is Janet Russo, and I am the CyberKnife Coordinator at Frederick Memorial Hospital's Regional Cancer Therapy Center. I provide case management and education and support to patients referred for CyberKnife treatment. I also coordinate the CyberKnife Ambassadors Support Group and perform administrative duties of the CyberKnife Center. The CyberKnife system uses image guidance technology and computer-controlled robotics to continuously track, detect, and correct for tumor and patient movement throughout the treatment. Because of its extreme precision, the CyberKnife system does not require invasive head or body frames to stabilize patient movement, vastly increasing the system's flexibility. The success stories are the best. And with the CyberKnife Ambassadors program, the survivors come back, and that's when I really am able to see the changes, and they tell me all about, how their cancer's gone and their symptoms are gone, and they can't wait to share this technology with other people, and that's really exciting.
I'm Bert Hauver, and I'm the medical dosimetrist and clinical coordinator in the Department of Radiation Oncology. Here in radiation oncology, we treat cancer by using ionizing radiation to kill cancer cells. To do this, we shape a high-energy X-ray beam to cover a target area while shielding critical structures in normal tissue. In this way, we are able to completely eradicate cancer in a particular area while minimizing damage or side effects to the surrounding tissue. We produce these X-rays and deliver our treatments using one of our 2 linear accelerators here at the center, like the one you see behind me. A treatment appointment takes between 15 and 45 minutes the first day and between 10 and 20 minutes on subsequent days. The patient's well-being is monitored during a weekly on-treatment visit with a doctor or nurse. Patients can also speak with the doctor or nurse at any time at their request. Our goal is to get you better and to make the experience as pleasant as possible in the process.
Hi, my name is Amy McGreevy, and I'm a patient navigator at FMH. A patient navigator at Frederick Memorial Hospital is an experienced oncology nurse who guides a patient through the diagnosis and treatment of cancer. The multidisciplinary lung cancer clinic provides timely consultation and treatment planning for patients with a known or suspected lung cancer. This is facilitated by a navigator. The Coordinated Breast Services program utilizes a patient navigator a little differently. The navigator's role here is to facilitate more timely diagnostic procedures or consultation with a specialist for the evaluation of abnormal breast findings. I like working with the cancer patients, and it just is fulfilling to help them and feel like you could be a resource to someone in that time when they're really needing some guidance.
And the goal of Coordinated Breast Services is exactly what it sounds like, to coordinate the care of breast patients either through diagnosis and treatment of malignant diseases or diagnosis of benign breast issues, taking them with the help of our patient navigators and their primary care docs from their initial mammograms. If there's a finding that warrants intervention, helping coordinate with the primary care physicians, a breast surgeon or general surgeon if needed, or a medical oncologist if needed, as well as with our radiologists to ensure that they get rapid diagnosis of any potential malignancies. If a potential malignancy is borne out, then getting them into treatment as quickly as possible to avoid patient treatment delays. One of the things that we found even nationwide is oftentimes between a mammogram and a diagnostic mammogram there can be a treatment delay. Between the diagnostic mammogram and some type of intervention in order to find a malignancy, there's another treatment delay. And then once a primary care practitioner is given the results, there can be a third treatment delay for finding patients oncology care. So we're trying to knock out some of those treatment delays by coordinating that care through one centralized location for the physicians and patients who choose to use the services.
Survivors Offering Support, or SOS, is an organization whose mission is to empower breast cancer survivors one life at a time. And we do this at FMH in a number of ways. The first way is to be on site on Wednesdays as survivors, providing mentoring support, providing emotional support to newly diagnosed patients. I'm there on Wednesdays, Joyce Tolley's there with me, and also Barbara Maneth. So you can always see one of the three of us on Wednesdays. We do other things as well. We offer a one-on-one mentoring program where we have over 50 women who are survivors in the community who are trained to act as mentors for newly diagnosed patients. And we match those patients to the mentors so that they can have emotional support, informational support, and practical advice. The second thing that we do is partner support workshops. Sometimes family members are as devastated or even more devastated than the patients are with the diagnosis of breast cancer. And so we run our patients' families or friends through this support workshop that provides them with insight into what the breast cancer patient is going through, and also what they can do for themselves to take care of themselves, because the caregiver's role is a very important one.
Hello, my name is Debbie Kuhn, and I work in the IV Therapy Center at Frederick Memorial Healthcare System. The Regional Cancer Therapy Center provides chemotherapy and a variety of treatments for residents of Frederick and our surrounding counties. These include chemotherapy, blood transfusions, antibiotics, iron infusions, and drug treatments for multiple sclerosis, rheumatoid arthritis, and Crohn's disease. Our goal is to provide very good care to all patients using our services in a compassionate manner. They show such courage in the face of a catastrophic illness. And it's very uplifting. Everybody says, don't you get depressed working with cancer patients? It's quite the opposite. These patients are some of the bravest people that I know, and so that's why I keep coming back every single day.
In our country, the leading cause of cancer-related deaths, unfortunately, is related to lung cancer. And currently, if a patient gets diagnosed with lung cancer, unfortunately, by the time they have gone out to see all the specialists that they need to see, obtain all the x-ray testing and specialized testing that they need to obtain, that entire time frame could take 3 to 4 months. One of our goals when we developed the Multidisciplinary Lung Cancer Clinic in 2004 was to be able to provide a one-stop opportunity for patients who are diagnosed with lung cancer to be seen by 4 specialists in a timely fashion. Those specialists include a thoracic surgeon, a medical oncologist, a radiation oncologist, and a pulmonary medicine specialist. After reviewing all the patient studies, the group would come together and host a conference where we would then develop a treatment plan, and that treatment plan would be rendered to the patient as well as their referring physicians. Our goal was to originally try to reduce this wait from 3 to 4 months down to less than a month. In actuality, we've been able to bring that down to about 12 days. So in a very short time frame, we can take complex individuals, assemble a complex treatment plan, and begin that treatment plan in a matter of weeks versus months.
Hi, my name is Sharon Evans.
And I'm Peggy Joy. We're the oncology social workers at the Regional Cancer Therapy Center. We provide comprehensive support services to patients and their families during cancer treatment. Our primary focus is to support and counsel patients regarding the psychosocial effects of cancer. These issues include stress management, lifestyle and financial changes, body and appearance changes, and coping with the emotional and physical aspects of cancer treatment. Because our patients matter most in what we do, we strive to build the bridges between professionals here at FMH and in the community to provide services and support in order to enhance our patients' lives during a difficult time through a comprehensive, multidisciplinary approach to cancer treatment.
When I can help them identify roadblocks to their treatment, how to cope more successfully with their illness, and it's very rewarding.
We're a good ear to bend. We're available to families, patients and their families, to provide support. We're someone to talk to on a confidential basis. and to help patients cope with the changes and the stress in their lives when they're diagnosed with cancer, through chemotherapy treatment, and adjusting back into their regular lives after treatment's over.
Each and every year, amazing progress is being made in the fight against cancer as new, better, and more effective treatment options are discovered. What you may not know is that right here at the FMH Regional Cancer Therapy Center, we are on the cutting edge of many of these new discoveries. Within the walls of this building, exciting research is conducted as we continually strive to improve the lives of our patients. The Clinical Research Department participates in more than 25 clinical trials on a variety of cancer diagnoses, including colon, lung, prostate, and breast cancers. Some of the studies we have participated have resulted in new and improved therapies for patients worldwide. I have to say that working with the patients, closely with the patients, is where my heart is, and as a nurse I think that's probably pretty typical of a nurse, but I like the opportunity to learn. As I said, we're right here on the cutting edge of a lot of cancer treatments, so it's really exciting to be part of that, the new hope for better treatments, for more cures for more people. That's just so positive. I find that very rewarding.
In short, whether you've been diagnosed with cancer, you know someone facing the disease, or you're just looking for information about resources in our community, we're here for you. For more information on the Regional Cancer Therapy Center, log on to fmh.org.